Go.
Would you use medical marijuana? Should medical marijuana be legalized? In our group, Brady, Haley, and I agreed with the use of medical marijuana, while Michael disagreed. Medical marijuana has its pros and cons of treating symptoms of terminal illnesses such as cancer and HIV/AIDS. As a group, we will explore the pros and cons of medical marijuana, how it affects legislature, and what people today think of the drug.
To begin our discussion, we'll take a look at the negative aspects for the use of marijuana. Legalizing marijuana for medicinal purposes poses many problems involving health and legal issues. Marijuana affects your mind and body, short and long term. According to Townsend, marijuana affects your cardiovascular system, respiratory system, reproductive system, and central nervous system. People that use glaucoma to treat a disease think that even if it doesn't work, it can't hurt them. Take glaucoma, for example. Glaucoma increases the interocular pressure of the eye, which can damage the optic nerve. And marijuana use can alleviate this pressure, but only for a short time. This causes patients to have to self-medicate hours on end, day and night. Cannabis ingestion induces tachycardia and decreases blood pressure. Tachycardia is when your resting heart rate exceeds 100 beats per minute. With tachycardia, the oxygen demand is increased, while the decrease in blood pressure decreases oxygen supply. The effects on your respiratory system are similar to that of tobacco, only greater. Tar buildup in the lungs can be 50% more than that of tobacco smoke. Chronic use often results in obstructive airway disorders. Frequent users often have bronchitis, cough, and hoarseness. Cancer is a big risk for marijuana users as it contains more carcinogens than tobacco also. The effects on the reproductive system for men, they have a reduced sperm count, and women have a fluctuation in menstrual cycle and hormone levels. The effects on your central nervous system are dose-related. Physiological symptoms may include reddening of the eyes, tremors, and muscle rigidity. The toll it takes on a person is also psychological. Short-term symptoms may include euphoria, relaxed inhibitions, disorientation, and relaxation. At higher doses, impairments in the learning and associative processes and motor skills may occur. Long-term symptoms may include lethargy, apathy, social and personal deterioration, and lack of motivation. Cannabis intoxication can occur. Anxiety, sensation of slow time, and poor judgment are examples of intoxication symptoms. Irritability, restlessness, insomnia, anorexia, and malnausea are possible withdrawal symptoms. Last but not least, marijuana also has many legal difficulties. Why was an input to legal use of marijuana in the first place? Marijuana was deemed an illegal narcotic in 1937 when association between marijuana use and criminal activity became evident. In 1996, California passed Proposition 215, which gave physicians the ability to prescribe marijuana for their patients, not just for serious conditions, but for any ailment which marijuana prevents relief. Now this creates a humongous loophole that many will take advantage of. Marijuana is the most commonly used illicit drug. Dennis Flaherty, Executive Director of Minnesota Police and Peace Officers Association, says, "It is an absolute enforcement nightmare. We're not convinced that there really is a medicinal purpose to marijuana. We see marijuana as a harmful drug and a gateway drug." Sanctioning marijuana for any purpose only gives a green light to illegal drug use and would further encourage it, according to some. A relationship has consistently been shown between early cannabis use and subsequent abuse of other drugs. Adolescents who smoke marijuana on a weekly basis are more likely to try other narcotics, such as cocaine or heroin, commit robbery, and engage in violence. Until test results indicate otherwise, it is safe to assume the negative effects outweigh the benefits.
Though there are many cons with the use of marijuana for both recreational and medicinal use, there are many pros that the media tends to cover up. Trine explains that only 6% of all studies are done on the positive effects, the rest being on the negative effects. But the problem with studying marijuana is that the use is illegal. Now, according to the CNN, the DEA, or Drug Enforcement Agency, lists marijuana in the top tier for most deadliest and most addictive drugs. But according to Dr. Gupta, he has never found a case where someone has overdosed on marijuana. Not all is bad about the future of marijuana, though. Since 1996, 18 states and the District of Columbia have legalized the use of marijuana for medicinal purposes. The uses of medical marijuana is endless, such as treating the symptoms of terminal illnesses, as cancer would be. According to CNN, the effects of chemotherapy on a cancer patient can be very harsh at times, with extreme nausea associated. Studies show that in between treatments, cancer patients have reduced nausea. In a study of multiple sclerosis spasticity, the trend overall was reduced noticeably spasticity, but not complete removal of all symptoms. But almost all patients noted that their quality of life had improved. On top of all the symptoms that it treats, according to the American Journal of Medicine, they say that though marijuana users usually have a higher caloric intake, their metabolism is heightened, which can lead to a weight loss. The American Association for Cancer Research has found that marijuana actually works to slow down the tumor growth in the lungs, breast, and brain considerably. According to a 2007 and a 2010 study by the California Pacific Medical Center Research Institute on breast cancer, they show that marijuana actually stops cancer from spreading to other parts of the body by downgrading a gene called ID1. As for its counterparts, brain cancer, Trine says that it actually works to kill the cancer by having them feed on themselves in a process called autophagy. In the same study, researchers did not find any toxic effects from the use of marijuana. In a recent CNN survey, 76% of all physicians surveyed say they would recommend or prescribe medical marijuana to breast cancer patients to alleviate pain. Now, glaucoma has one of the brightest futures of all the medical marijuana fight, because there is yet to be a study that has found negative effects when looking at the treatment of glaucoma. It treats glaucoma by reducing the intraocular eye pressure by an overall average of 24%. Though marijuana is a good treatment, the AGC, or American Glaucoma Society, still does not list it as a suitable treatment. As there are many ways to disprove the theories about the symptoms being cured of medical marijuana, the testimonials of patients really brings reality to the fact that our society needs an alternative to the all-current prescription drugs. In fact, sometimes marijuana is the only thing that works. Dr. Sanjay gives us the case of Charlotte Feedy. She started having seizures soon after birth. By the age of 3, she was having over 300 per week, despite being on 7 different medications. Marijuana has since calmed her brain, limiting her seizures to 2 or 3 per month. Sudero shows us a case where Mike Graham, a 47-year-old former restaurant manager, has a degenerative disc disease, left bedridden with terrible nerve pain. He described his pain as like getting hit with a baseball bat every time my heart beat. Painkillers and a morphine pump did not work. A hospice nurse suggested he try pop. He now takes several puffs every 3 hours. There is no euphoric feeling, but he can now have a semblance of life. Here's a video from the USA Today that shows a toddler with severe brain cancer whose mother is advocating for medical marijuana.
Suffering through seizures and near constant pain.
She had angry outbursts when she's sleeping even, in the middle of sleep. so bad that I'm scared to lay next to her. She actually is capable of hurting someone.
Her mother, Mariah, says perhaps even more debilitating than what's left of the tumor inside her daughter's head, the side effects from chemotherapy.
And her pain and her nausea, her vomiting, hearing her cry.
In search of alternatives, Dahlia's desperate mom was contacted by scores of individuals suggesting something less conventional, medical marijuana.
I absolutely never would have condoned giving a mind-altering substance to a child. It would have horrified me, even if you told me the child was very sick.
But after researching potential benefits, Mariah says she was sold on the idea of medicinal marijuana for her daughter. Not the kind you smoke, but the medical-grade pills and injections administered by a doctor. Problem is, that type treatment is not available in the setting of a children's hospital where Dahlia is receiving round-the-clock care.
Even in states where it's legal, no hospital or even physician with federal standing is going to use this drug. It's federally prohibited, and until that federal prohibition is lifted, we won't be able to get the care that could possibly save her life.
And it's really amazing. We've gotten an incredible response. Thousands of likes and shares on social media on our story about Dahlia from last night. Her mother's really trying to make this type of treatment available for her daughter. She's created a petition here on the White House website, and take a look at this. She's already got over 1,000 signatures on the petition, and she's keeping everyone up to date with the Dahlia's Law Facebook page with all kinds of information on what's happening with her daughter and the latest on her treatment.
Though many citizens and doctors find that marijuana medically is a good idea, it still has to be passed through legislation to become a legal option. In Philadelphia, Representative Mark Cohen is the sponsor of a bill that would allow people who suffer from illnesses like cancer, HIV, and glaucoma to buy small amounts of marijuana to treat pain and nausea that are brought on by their illnesses. The users would have to register with the State Department of Health and carry a certified identification card. They would only be allowed 6 marijuana plants or 1 ounce of usable marijuana at a time. In 2009, municipal legislators passed the legalization of medical marijuana, but was stopped when Governor Tim Pawlenty vetoed the bill. Now they are trying again to pass the law. Law enforcement is very skeptical about the legalization of medical marijuana. They say it's hard enough to control marijuana recreationally, and that if medicinal marijuana is legalized, the rate of users for both will skyrocket. In 1999, the Institute of Medicine conducted a revolutionary study on the possible medical effects on medicinal marijuana. This began the battle over whether we should or should not legalize the drug. Many people say that if the drug is legalized medicinally, that it will just lead a pathway to legalize the drug for recreational use also. In Colorado, evidence shows that groups pushing for the legalization of medical marijuana in 2000 are the same groups who are for making the drug legal now. In 1996, California passed Proposition 215, which legalized marijuana for any kind of medical condition that the drug would relieve. In just a month, the state had given out over 100 permits to a town of just 16,000. People were doing anything they could to get their hands on the drug. For over a decade now, doctors have been prescribing THC to patients. THC is a form of the drug, but is not nearly as useful. In pill form, it is called Marinol. THC is used to help appetite in AIDS patients and treat pain and nausea in cancer patients. When taken orally, THC's effects are delayed quite a bit, which makes it hard for doctors to decide the dosage for patients. Richard Lee is the founder of the nation's first marijuana trade school. His business brings in over $7 million a year. He is pushing for Proposition 19 in California. The proposition would allow people 21 and older to grow and possess marijuana and allow local governments to permit retail sales and collect taxes. He spent over $1.5 million trying to pass this proposition. Most of the studies on marijuana just search for the harm the drug could cause. It's very hard for scientists to take tests on the drug, which makes it even harder for legislation to even think about passing the laws to legalize the drug.
Although we found the opinions of professionals, we also wanted to know what people in this area think. What is your opinion on marijuana? Does the area of Breck Walk have a marijuana problem? These were 2 of the questions asked on a survey our group issued. This particular survey was given to the junior class of BHS, 3 teachers at BHS,